MP Chris Green is one of the MPs in the COVID recovery group. Chris, good morning to you. It does feel like a happy day today, although a lot of people sort of dare to dream. Are we going to come out of all restrictions July the 19th? Probably not. Are we risking at some point being told we're going to have to go back in again? That's the big fear. But it does sound like there has been a real change in the government in the last week. How much of that do you think is down to the data, which we're apparently suddenly seeing? The rest of us could see it quite a few weeks ago about the vaccinations working and the break between cases and deaths, but also in the change in the top people at government. The Health Secretary, Matt Hancock, resigning, replaced by Sajid Javid, Michael Gove, Hancock, axis of power within government being broken. How much do you think is down to that or down to the data?
Good morning, Julia. The narrative certainly is very different, but in terms of what we're going to see and the changes ahead. Now, obviously, we're going into the summer. Summer is supposed to be the easiest time in terms of these respiratory viruses, and so we're going to have the minimum of controls and minimum of regulation, but it's not a full unwinding. This isn't the disposal of the Coronavirus Act itself. That's still in place. It's kind of going to be at a minimum lockdown level, but we know when we get to September, get to the autumn, and the usual return of respiratory viruses and everything else, it can go back up again. So if this were the final step, in a sense, a Freedom Day, that we're anticipating, then we wouldn't need the Coronavirus Act itself.
Yeah, and that was the big concern when that was extended for such a long period of time, wasn't it? That was the big warning sign. And there are real concerns. I mean, certainly with, the opposition from Labour hasn't been basically, have a lockdown sooner and longer and stricter most of the time, that actually if the government did decide to or felt pushed into going in for more lockdown restrictions in the autumn, they would have the votes in Parliament to do it. How do we stop that from happening? Because if we are still under effectively emergency rule, even when supposedly we have most of our freedoms back in the summer, what is to stop us having this, not just this winter, but the winter after that and the rest of our lives?
Well, that's a huge question. It's the Coronavirus Act itself was intended for 2 years. That was right at the beginning when we had relatively little understanding of the disease itself. And it looks like it's going to be retained. It'd be great if the Prime Minister were to announce today that we don't need it anymore. We're going to learn to live with the disease, because that's what I would understand. No other particular disease has legislation like this. And it's also quite strange the way the data's being used, because actually, if you look at the data at the moment in terms of hospitalizations, in terms of transmission, and a number of other factors that the government put out there, the figures are ever so slightly worse now than they were a month ago.
Yep.
And that's not really consistent. So is it because the new people are in place, they're interpreting the data in a different way? Or is it because the mood of the Conservative backbenchers has really shifted? There were deep concerns and a general expression of, I'll vote for an extension once, but never again. But ultimately, this ought to be seen not as a Freedom Day, but as a minimum lockdown level. How low can these measures get?
Yeah.
And this is probably what's going to be announced today. And it's that commitment. If someone's running a business, what commitment do they have if they're going to be reopening their business, perhaps recruiting people, that they're not going to be locked down again in September or October?
And that's the thing, people are still operating with their hands tied behind their back, and we've had all these people saying, we're not in lockdown right now, you can go to the pub. The fact that the pubs, the restaurants, the theatres, the cinemas, loads of entertainment, or hospitality, travel, the fact that none of them can make even the semblance of breaking even, let alone a profit, doesn't seem to bother an awful lot of these people. What do you make of the people from, say, Alternative Sage and others? I mean, most of them card-carrying communists, by the way. I mean, quite literally card-carrying communists. What do you make of their attitude, and indeed many of those advising the government formally as well, who say that this is far too soon to lift restrictions? Cases are rising. We should be having a mask mandate continuing, possibly even indefinitely in public places. What do you make of those people and their motivations?
The motivations can be many and varied. And one thing they've got to do on Sage, Alternative Sage, and the other advisors, is they're only focused really on the coronavirus itself. We never really hear from them from their perspective of how many people are waiting to go into hospital. It was quite extraordinary, I thought, that running up to the debate last time over the last vote for the extension, the widely understood view of the hospital waiting list was 5.1 million people. I don't know how long that backlog is going to take to clear. The government haven't set out how long it will take to clear. And a couple of days after that vote, once the politicians had agreed with the government to maintain the lockdown position, it then emerged that the real hospital waiting list figures should have been 12.2 million. That's absolutely extraordinary. So I don't know how much SAGE really look at that. But one of my fears is, even though the former health secretary has said, we'll start to treat COVID like we treat influenza, my fear is what they might actually be doing, or there might be a certain sense within the system. Wouldn't it be useful if the NHS and wider government had the ability to treat influenza as they treat coronavirus, imposing lockdowns, mask mandates, social or antisocial restrictions?
Yeah. I mean, that is the real worry, isn't it? I mean, the new health secretary, Sajid Javid, though, it has brought a big change in the mood. Clearly breaking that axis with Michael Gove, where it was Michael Gove and Matt Hancock who were really pushing for stronger measures, longer measures the whole way through. We know that Michael Gove is in some personal difficulties at the moment, and perhaps he's focused on those. Sajid Javid, it's very clear he took the job on the basis of the standpoint that he had. And we know even as far back as March last year, he was talking about how we should be coming out of restrictions. And he wrote an interesting research paper in December last year saying that world leaders had exhibited herd behaviour following China's measures and were sort of like, he likened them to panicked shoppers stockpiling loo paper in terms of the reactions to COVID. Very encouraging that this is a man who thinks that, the economic impact and the health impact of the focus on COVID has been too much. A piece he wrote for the papers on Sunday, making it very clear what his priorities are. Does that give you more optimism that this is a one-way route out of lockdown now and we won't be returning in the autumn, or do you think we still should be on guard for that?
I think as a default position, instinctively, Sajid Javid is more challenging on the lockdown agenda than Matt Hancock. I always had the sense of Matt Hancock, he would default to lockdown given the choice. Sajid Javid seems to be the opposite way. And where we are at the moment almost seems to be, and this is quite a positive thing, is the government setting a robust agenda for unwinding lockdown. And it's almost as though the government's saying, right, Sage, you think we should still be in these lockdown measures, wearing masks and everything else. You win the argument. They're going to be all over the media in the coming couple of weeks. They're going to be all over the media pressing their agenda. And it's a question now, how much will the government hold the line? How much will the government reject those advances from SAGE and say, you know what, children returning to school in a normal way in September, employers being able to get people back to work, dealing with that incredible backlog, but also perhaps civil liberties and the freedoms we should be able to take for granted.
Absolutely. Yeah, I'll tell you one thing. I will be cheering the Prime Minister on if he announces what we're hearing he's going to announce 5 o'clock tonight, but I refuse ever to be grateful to get what was mine already back. I am not grateful for being given my freedoms back. They were already mine. They were snatched away from me without my permission, and I won't be thankful for it. Stockholm Syndrome's got to end at some point. Chris Green, member of the COVID Recovery Group at talkRADIO.